Yeah, and that's a good one to talk about, just the concept of central sensitization and how that's really changed things in the last 10 years or so, understanding that there are people out there that are just generally sensitive to nerve input. And that you've got to sort of cordon those patients off and treat them a little differently.
I do want to come back to central sensitization for a minute, just because I do think this is so important. And I love to tell my own story because I feel like it's a hard thing to talk about without people thinking that you're saying that the pain is in their head, right? It's really a very, very difficult topic. For me, I was working as an anesthesiologist, but I had already had my Tarlov cyst surgery, but I still had a lot of pain. So in between cases, if I was on call, I was working in like a lot of smaller hospitals. I'd go and I'd lay down. And, I was making it okay, but I was doing locum tenens and it was tough. It was a little tough, especially if I had to wear lead because I was in a, urology room or whatever. But anyway, I watched a lecture by our colleague, Dr. Dan Claw, about central sensitization on YouTube, and the light bulb went off. I was like, oh my gosh, because for years prior to that, I was aware that in the operating room, I could no longer look like into the incision. The bright lights would immediately trigger a migraine. And if I would be driving in a car and the light would be coming through the trees, like I would have to put my hands up to block that light, kind of like going like this through the trees. So I knew that my nervous system was very sensitized, not just to pain, but to other sensory inputs. And so when I learned that there was a word for that, and keep in mind, I was working as an anesthesiologist for over 20 years. So I went through medical school, anesthesia residency, and I still didn't really know what this was. And when I saw this lecture, I was like, oh my gosh, that makes so much sense.